Infectious diseases pose a significant threat to global health, caused by various pathogens such as bacteria, viruses, fungi, and parasites. Understanding the types of infectious diseases is crucial for effective prevention and treatment. This article provides a comprehensive overview of these diseases and their impact on human health. What are the types of infectious diseases? What are the common symptoms of infectious diseases? How are infectious diseases spread? What does an infectious disease specialist do? What are the stages of infectious diseases? How can you prevent infectious diseases? What treatments are available for infectious diseases? Related questions about infectious diseases. What are the 4 types of infectious diseases? What are the 5 types of infectious diseases? What are the 20 most common diseases? What are the 5 incurable diseases? What are the types of infectious diseases? Infectious diseases can be categorized into several types based on the causative organisms. The types of infectious diseases in humans include bacterial infections. These are caused by bacteria and can lead to illnesses such as pneumonia and strep throat. Viral infections. Viruses like influenza and HIV fall into this category, often requiring specific antiviral treatments. Fungal infections. These include conditions like athlete's foot and thrush, typically affecting individuals with weakened immune systems. Parasitic infections. Caused by parasites such as Giardia and malaria, these diseases often result from contaminated water or food. Each type of infectious disease presents unique challenges and risks to public health. Recognizing the signs and symptoms associated with these diseases is essential for timely intervention. What are the common symptoms of infectious diseases? Common symptoms of infectious diseases can vary widely depending on the type of infection. However, many share similar characteristics that can help in identifying the illness. Fever, often a primary indicator of an infection in the body. Fatigue, a common response as the body fights off the infection. Pain or discomfort, this can occur in specific areas depending on the type of disease. Coughing or sneezing, particularly prevalent in respiratory infections. Recognizing these symptoms early can be pivotal for effective treatment. Many infectious disease symptoms can overlap, so consulting a healthcare professional for accurate diagnosis is advisable. How are infectious diseases spread? The transmission of infectious diseases can occur through various routes, making understanding these pathways vital for prevention. Direct contact, touching an infected person or their bodily fluids can lead to transmission. Airborne transmission, diseases like tuberculosis can spread through droplets in the air when an infected person coughs or sneezes. Vector-borne transmission, insects such as mosquitoes and ticks can carry and transmit diseases like malaria and Lyme disease. Food and water contamination, consuming contaminated food or water can lead to infections like hepatitis A. Implementing good hygiene practices and public health measures is essential to mitigate the spread of these diseases. What does an infectious disease specialist do? An infectious disease specialist plays a critical role in diagnosing, treating, and managing infections. They are experts in various aspects of infectious diseases, including diagnosis, utilizing laboratory tests and clinical evaluations to identify infections. Treatment plans, developing tailored approaches based on the type of infectious disease and patient history. Research, contributing to the understanding of infectious diseases and the development of new treatments. Public health advocacy, promoting awareness and preventive measures within communities. Their expertise is especially vital in handling complex cases, including those involving antibiotic resistance. What are the stages of infectious diseases? Understanding the stages of infectious diseases can help in managing and treating them effectively. Typically, these stages include incubation period, the time between exposure to the pathogen and the onset of symptoms. Prodromal stage, initial symptoms appear, often vague and nonspecific. Illness stage, symptoms become pronounced, and the individual feels unwell. Decline stage, symptoms begin to subside as the body fights off the infection. Convalescence stage, recovery takes place, with the body returning to normal function. Recognizing these stages can aid in timely medical intervention and improving patient outcomes. How can you prevent infectious diseases? Prevention strategies for types of infectious diseases are critical for reducing their incidence and protecting public health. Effective measures include vaccination. Immunizations protect against various infectious diseases. Good hygiene practices. Regular hand washing and sanitation can significantly reduce transmission. Safe food handling. Proper cooking and storage of food help prevent foodborne illnesses. Avoiding close contact. Limiting exposure to sick individuals can help reduce the risk of infection. Implementing these preventative measures is vital for individuals and communities alike. Education and awareness are key components in the fight against infectious diseases. What treatments are available for infectious diseases? Treatment options for various types of infectious diseases depend on the causative agent and severity of the condition. Common treatments include antibiotics, used for bacterial infections, although resistance is a growing concern. Antivirals, medications that target viral infections, such as HIV or influenza. Antifungals, treatments for fungal infections like Candida or aspergillosis. Supportive care, this includes hydration, pain relief, and other supportive measures that aid recovery. Timely medical intervention is crucial, especially in severe cases, to minimize complications and improve prognosis. Related questions about infectious diseases. What are the 4 types of infectious diseases? The 4 main types of infectious diseases are bacterial, viral, fungal, and parasitic. Each type has unique characteristics and modes of transmission, requiring different approaches for prevention and treatment. What are the 5 types of infectious diseases? In addition to the 4 types mentioned, one can consider prion diseases as the 5th type. Prion are misfolded proteins that can cause neurodegenerative diseases, such as Creutzfeldt-Jakob disease. This highlights the complexity of infectious diseases and the diverse pathogens involved. What are the 20 most common diseases? Some of the most common infectious diseases worldwide include influenza, tuberculosis, malaria, hepatitis B and C, measles, chickenpox, gonorrhea, syphilis, strep throat, norovirus infection, rotavirus infection, Lyme disease, West Nile virus, chlamydia, dengue fever, Zika virus, schistosomiasis, giardiasis, trichomoniasis, Clostridium difficile infection. What are the 5 incurable diseases? 5 examples of incurable diseases include HIV/AIDS. While manageable with antiretroviral therapy, there is currently no cure. Multiple sclerosis, a chronic autoimmune disease with no known cure, though treatments can manage symptoms. Alzheimer's disease, a progressive neurodegenerative disorder with no cure at this time. Parkinson's disease, a chronic condition affecting movement, with treatments focused on symptom management. Type 1 diabetes, a lifelong condition where the pancreas produces little to no insulin. Addressing these diseases requires ongoing research and patient care strategies.